Hey everyone, thank you so much for coming to my training today. Of course, I wish it could be in person, but we will improvise a little bit and maybe some things that we would usually do, a little more hands-on. We'll do the best we can to make sure this training is still fun for everybody and you get as much as you usually would out of it. So, for this training course, I am Mark Farmer. I am your instructor today, and we will be going over patient lifting and heavy lifting training here at Wealdie Assisted Living. So, on the agenda, we have a quick introduction where we will cover some statistics in regards to lifting heavy objects in the workplace and some injuries that come along with that. We will be going over Wealdie heavy lifting requirements, a quick overview of proper lifting techniques, an overview of patient lifting equipment, and then finally we will end on a conclusion, and hopefully by then you will not be lifting like Homer Simpson here on the right. You'll be lifting more like his two friends there on the left. So for the introduction, over the past 7 years at Wealdie Assisted Living, 15% of the overall injuries have come as a result of heavy lifting and patient lifting activities. 13% of the unsafe acts identified in workplace inspections are improper lifting. And so we're hoping to correct a few of those and reduce that injury rate through training everybody and making sure everyone knows the proper lifting techniques to prevent those injuries. And lastly, some common heavy lifting injuries are back strains, spinal injuries, muscle pulls, wrist, elbow, and shoulder injuries. So that can be tendonitis just from repetitive lifting or lifting heavy objects or poor technique. Next, Wealdie heavy lifting requirements. So here at Wealdie, and this is a pretty universal weight limit, but we have a 50-pound maximum. So if you have an object that is 50 pounds or heavier, you must get help to lift that object. You cannot do it by yourself because it puts you at a higher risk of injury if the object is 50 pounds or heavier. So please either break that load up into two lighter loads if possible. Of course, if that is a person or a patient, can't really break it up into two lighter loads. So get help doing that. And so either use a lifting tool such as the patient lifting device we'll go over towards the end of this training. Get help, so at least two people per patient is our rule. So if you're lifting a patient, you need a partner to help you out. We have had a few injuries, just uh, somebody trying to lift a patient on their own and maybe a malfunction in the lifting tool, or maybe the patient is a little bit too heavy. So having another person around there just to monitor that situation and offer a little bit of help does greatly reduce the chances of an injury. Next, work within your limitations. So 50 pounds is the maximum, but everybody's different. So if 50 pounds is a little bit too heavy for you, or if 40 pounds is a little bit too heavy for you, take the proper precautions to prevent those injuries. Get a tool if you need it, use a hand truck, a cart, whatever you may need to make sure you lift that object safely. And lastly, report early symptoms to a supervisor. If your back starts to flare up, if your shoulder starts to hurt, let somebody know. That way we can take the proper precautions to guide you through, this potential injury and make sure you are coming to work every single day healthy, and we're monitoring your situation and making sure that you remain as healthy as possible. Next, so this is going to be the meat and potatoes of this training. We want to make sure every single person in here can demonstrate proper lifting technique. Usually we would get up together and work on this as a class. It's usually a fun activity, but due to our limitations of being online, we're just going to go over these, and I'm going to make it as clear as possible. So step one, stretch. So get up before you have that lift, stretch, touch your toes, stretch out those hip flexors, those hamstrings, loosen up those muscles, make sure that your body is prepared to lift this heavy object. Not only can it reduce back pain, but It can prevent strains and pulled muscles. Next, step 2, bend at the hips and knees. So as you can see, these workers on the right side are doing a fantastic job. Not only did they offer help or get help, so they're working together to lift this heavy object, but they're using proper form as well. You can see that they both have a straight back. They have a nice Z in the knees. They're prepared to lift this object, and they have a good grip on the object, which is our next step. So you can see on the left picture, this dude, had a poor grip on the box. He has one hand on it. That's causing his posture to be awkward. And as you can see on his face, he's hurting. He wish he hadn't done this alone or got help, or at least taken the time to find a good grip on that box before he lifted it up. Now he's hurting. But luckily, he did make an adjustment. He's finally using the handles on that box to make this task a little bit easier. By the look on his face, I'm sure he wishes he did this the first time, but at least he's doing it correctly and fix that lifting form. Next and last, straighten the hips and the knees. So power through that lift. Don't bend your back on the way up. I know it can be tempting. Just pay attention to this picture on the bottom of this slide. So he has step 2, and right now he's bending at the hips and the knees. He's got a nice straight back. And then all he does is just straighten those hips and those knees and stand up straight. It's pretty simple. Anything under 50 pounds, remember, you can do alone if it's within your limitations. So just try to mimic this form right here. He's doing a great job. Next, patient lifting equipment. So due to our time limitations, 6 to 8 minutes, we're just going to go over the main piece of patient lifting equipment which we use here at Wealdie Assisted Living, and this is the Hoyer patient lift. So we're going to allow this great video to demonstrate how to use this piece of equipment correctly, because obviously we are online and I can't demonstrate this in person. So we'll watch this quick video and we'll get back to the presentation.
The first step to any transfer is ensuring that you have the correct sling. So be sure to check out our detailed sling selection guide before diving into these how-to videos. Today we're going to demonstrate how to safely transfer a patient from a bed to their wheelchair. Begin by folding the sling in half with the smooth side end and place the sling beside the patient. Gently roll the patient to one side, line the folded sling up with the patient's tailbone and head, then roll half of the sling up and tuck it underneath the patient. Carefully roll the patient to their other side, unroll the sling so that it is laying flat with the smooth side up before returning the patient to a lying position. Gently raise each of the patient's legs to pull the straps underneath and over the patient's legs. You want the straps to be mid-thigh on the patient for the most comfortable transfer. Finally, cross the leg straps, pulling one strap through the other, and you're ready to bring in your lift. Approach the patient with the lift and lock it in place once it is in position. Connect your sling's loops through the lift bar, keeping in mind that the shorter loops will result in a more reclined patient position. Before lifting, make sure that the patient is fully inside the sling and that the straps and loops are not caught on the bed. With one hand on the patient and one hand on the lift controls, slowly begin lifting the patient. Once the patient has been lifted fully off the bed, you can unlock the lift and move the patient to their wheelchair. Lock the wheelchair in place and position the patient over the chair. With one hand on the patient and one hand on the lift controls, slowly begin lowering the patient. Unhook the sling's loops from the lift and move the lift out of the way.
So there you have it with the Hoyer patient lift equipment that we use here at Wealdie. If you have any questions, feel free to ask after this presentation, and hopefully I can get in there and show you how to use this equipment in person. So to wrap up this patient and heavy lifting training program here at Wealdie. I want to go over a few points that were made throughout this training. So, heavy lifting is responsible for a huge amount of workplace injuries, and so it is our responsible to make sure we are understanding the proper mechanics to prevent a lot of those injuries. Next, report any symptoms early. If your back hurts, please let us know. If your shoulder hurts, please let us know. That way we can take the proper precautions to get you all healed up. Next, ask for help. Even if it is under 50 pounds, work within your limitations and make sure that you can lift objects safely. And remember, 50 pounds is the maximum lift for one person. Use the proper lifting mechanics. And 2 people per patient is the policy here at Wealdie. So if you have any questions, please ask. Talk to your supervisor about any injuries. I hope you guys enjoyed this training. Thank you so much. I'm Mark Farmer, and I will see you later.